I'm going to explain about the who is using the microphone. The level of oxygenation and oxygenation hemoglobin. We have oxygenated hemoglobin, deoxygenated hemoglobin. Okay? After firing our bundle of neurons, what happens?
Blood oxygen level decreases.
What decreases?
Blood oxygen level decreases.
Oxygenated hemoglobin decreases. Once we fire a bundle of neurons in our brain to increase the demand of our brain to the oxygen, to the consumption of oxygen, the level of oxygenated hemoglobin decreases. After this step, what happens? For the first step, it's off. After this step, what happens? The oxygen level of our blood diminishes. At early stage, this is true. But after this stage, what happens?
Neurotransmitter.
Neurotransmitter is the very primary stage of firing out neurons. Okay. First neurotransmitter is released. This is called neurovascular cooling phenomenon. Okay. After this step, we have the decrease,
Blood oxygen.
the decreasing oxygen level of our blood, decreasing oxygenated hemoglobin. But after this step, what happens?
Blood flow increases to our body.
Blood flow increase. Our body try to make up the decrease of oxygen level within our brain. The level of oxygen increases within our brain, but is more than the increase of oxygenated hemoglobin is more than is what the value is required for immediate metabolic demands of more than what we need. So the level of oxygen decrease or increase at this stage increase. At the first step, immediately we have decrease. After making up this yes, we have an increase in the oxygenated hemoglobin. Decrease, increase more than what is required for immediate metabolic demands of our body. So we have excessive oxygen. In this situation, we have higher level of oxygen. I want to say a fact about the effect of oxygen on the MRI signal. Then we have a low level of oxygen. We have lower signal in the And in the case of having a higher level of oxygen, you have higher level of signal in your arm. So tell me, in the first step, we have bright signal or dark signal, and the second and the next step, what is our situation? In the case of the level of signal, then tell me in the situation of having high or low oxygen level, which level of signal we have? The first stage, the second stage. The first stage we have
First,
decreasing oxygen.
decrease as
We have
low dark
lower signal.
signals.
In the next situation, we
Yeah.
have
Bright
high
signal.
level of oxygen. We have high level.
Hello.
You can see what happens in this curve. This curve is drawn by here a short stimulation. For example, a visual stimulation at a very short time. Here we have an initial leap into decreasing oxygen. In this case, here we can higher level of oxygen and higher level of signal. So finally we have term regarding the activation of our neuron, and we can see the changes in blood flow and oxygen level in this curve. This curve is very important. We call it hemodynamic response, bold hemodynamic response function, or hemodynamic response function. Define changes in blood flow, blood volume, which involve in functional magnetic resonance. This factor is very important. Functional magnetic resonance imaging is very interesting technique in MRI. If you have a special stimulation, for example, visual stimulation, this phenomenon occurs in the occipital, not other areas of the brain. Each area of the brain involved in that specific task or stimulation is activated. Based on this fact, based on the changes of the level of oxygen. We'll continue till 1 o'clock. Okay, and then 1:30, the class will start till 3 o'clock. Please attend that class. You are a leader. If some of you decide to Surgery in and around this region carries a high risk of paralysis and loss of function. It's very important to map this area. Surgeons like to have a reliable map of this area before surgery. Okay, it's very important. Using functional MRI, we can have this map. What just thing is important is that we set special task of primary cortex or sensor related to primary or sensor cortex. For example, finger tapping, it relates to the motor cortex. Finger tapping. The patient, the subject is asked to tap her finger in a period of time, and we are capturing her signals from his brain, and after performing some analysis, we can have motor cortex mapping like this. Motor cortex mapping. Different areas of the brain involved in this task, in this activation, is activated, and you can see on the image the activated area of the brain. It's very important for surgeons to know the activated area, regarding to the motor cortex, because he wants to have a surgery. This surgery carry risk of paralysis, loss of function. What if surgeons know and have enough information about the different areas and different focal cortex regarding different activation within our body? The level of accuracy of the surgeon will increase. Functional MRI is performed in different centers in Tehran. Visual system mapping. In some cases, surgeons want to know about the areas of the brain involved in visual activation. We set visual tasks for these patients and accurate signal from her brain to map visual activation. We know visual activation is related as occipital. Language testing. Sometimes we want to know about the areas involving language, vocal, pharynx. We can map these areas. For example, with phonological paradigms, we can allocate activation of vocals area. With some tasks like silent word generation, silent word in the case of mapping vocals area, we have silent word generation. The subject is shown a letter, and over the next 5 to 10 seconds is asked to silently think of as many words as possible, starting with that letter. Silently think of as many words as possible, starting with that letter. We have the duration, which is called control rest. Patients don't perform anything. Just look at the screen without doing any task. We call it rest or control periods. In this situation, the subject is shown nervousness symptoms, groaning, other tasks may use for subjects, groaning, naming, analysis, or semantic paradigms to elicit activation of learning area. In this situation, the task used may be sentences completion, true false statements, reading comprehension, listening comprehension. These are different tasks we use. And finally, we have different processing steps which are used to achieve the final image, color-coded image we saw. Okay? We have pre-processing, we have statistical analysis, complicated statistical analysis, very complicated. And maps, interpretation of results is very important. And so on. Functional magnetic resonance was very interesting.
Yes.
Is very important technique in MRI.